Hi
Yep.
everyone. So today I have Jules, who's a speech therapist with me. She has her own business called Child Speech Therapy, which is based in Rhodes. And I thought we'd have a little bit of a chat to her. Hi Jules, thanks for coming to our interview today.
Hi, Emily. Hi, thanks so much for having me. Happy to be here and answer any questions. And yeah, did you want me to start off by saying a little bit about myself, or did you want to get
Yeah,
straight to the questions?
fill us in about your business and what you do.
Yeah, sure. So I've been a speech pathologist for 13 years in Sydney, and I also went to London for a couple of years to work over there with the Tier 5 visa, so when it was still operating. We are mostly early intervention or children under 6 years of age, and we do see a lot of children on the spectrum. So I did an additional master's in inclusive education in autism. So we see a lot of children who are showing signs on the spectrum or already have a diagnosis. We're a smallish clinic. There's just 3 of us here, and we like it that way for now. You know, we're busy all the time, but we also feel that we're providing lots of quality time and resources to the community. So I also link in with the RIDE Community Health and do free in-services there and just chat with the other speech pathologists just to see what's available in the community for community health as well as private clients, and yeah, just loving it. And I do that with the local preschools and childcare as well. So yeah, it's really fun.
That's amazing. And I think that's so important for all speechies to do, is whether you're in private practice or whether you're in a community health setting or a hospital setting, our goal ultimately is to help children and to help families. So the more we can work together, the better outcomes we can have for our clients, our patients, and just for families and the community in general. So that's great.
100%. And I'm so passionate about that early intervention, and educators, childcare workers, they're the front line, and they're seeing all of our little kids, and some of them don't have the budget for that professional development or upskilling. So happy to do that and duck in. I think it was an initiative of SPA actually when we graduated all the way back then, and just continue doing it because I like it.
Yeah, no, that's fantastic. And I'm sure it's really helpful for them as well.
Yeah. No, the feedback's great. So yeah, it's been really good.
Fantastic. So if we're talking about your team, what would you say is a top quality that you look for from a new grad or anyone coming to you with experience when they're doing an interview?
Yeah, that's a really good question. So like a lot of clinics, we are hiring, and we do look at, different CVs and have chats with other speech pathologists who are interested. And definitely what we look for is a can-do attitude. So yes, obviously having a degree in speech pathology and a member of SPA, but also interpersonal skills. So I guess bedside manner and having that chat with the family. We don't see anything as kind of right or wrong in terms of everyone's personal preference or their passion area for doing therapy. It's just, we really do look for how they relate to people. And obviously getting along with the team. Some people prefer to be in a team environment, some prefer solo. We have a mix. So
fantastic. That's great. And so you've been a speechie long term now. So what does it mean to be successful as a speechie to you?
Oh gosh, I think because it's been such a long time, I've seen just so many changes in the industry. I can definitely relate to being in, the environment where you're just working nonstop. And I used to think that was successful, right? You booked out, you're nonstop. But now I think with so much shift on like mental health and lifestyle balance, I think having a good lifestyle balance and looking after yourself as well as looking after your clients and asking for help if you need it, not taking on more than you can handle, and just doing professional development, trying new things. I just think that that's, what would be considered successful.
Yeah, and I think that's so important. You can't be helping children and giving them therapy if you're burnt out yourself.
100%. And I think it's a big key issue in any field, any health field, right? It's the number one. I think health practitioners are the number one for stress and anxiety. So, just being aware of that and not worrying about, your numbers and trying to be everything to everyone. So yeah.
Yeah, fantastic. And is there any sort of final words of wisdom or advice you would love to give to new grads or student speeches?
Yeah, sure. So I would just advise to reach out. So we have new grads and even students reach out to come and observe and ask lots of questions. We're more than happy to help. I think every speech pathologist is, and it's a great way to learn about the industry and what areas there are and maybe what clicks with you. And just get out, ask for help, observe as many places as you can. Don't feel like there's any silly questions, and, have fun. I know the degree was quite hard, and there's just a lot of support out there. So definitely put your hand up. That's the advice I would give.
Yeah, fantastic. That's so good. Thank you so much for coming on today and chatting to us.
Absolutely.
A lot out of it. If anyone wants to get in contact with you, where's the best place to go?
Yeah, sure. So jump on our webpage, which is www.childspeechtherapy.com.au. We've also got Instagram, which is @childspeechtherapy. Feel free to, our number's on there, give me a call, send me a message. And we're happy to help out, or if you're interested in a role or job.
Lovely. Thank you so much, Jules. Thank you again for your time.
No worries. Thanks so much.
And we'll see you guys for the next interview. See ya.
Great. Thanks so much, Emily. Take care.
Bye.
Bye.